We also believe that we needed to change, and I have met a few physicians in the audience. We also need to change the way we as a payer interact with the provider community. Instead of it being a contentious relationship where they see us as somebody who's denying care, denying a test, denying some aspect of care that they believe their patient needs. Instead, we're setting up guidelines jointly with the physician community, not only primary care doctors, but specialists. And those guidelines include, okay, we agree that these are certain pathways of care. And remember what I said in the beginning, and we're all looking at the same real-time data. And then we're saying this is what we'd like to achieve for the individual patient. This is what we'd like to achieve for your population within your practice. And if we achieve certain levels, there's a base payment for the services, but if you achieve certain levels, we share in the savings. So the incentive to you as a physician is to work collaboratively with us as a payer, and in fact to really bind yourself to us in caring for that member. And I have to say, not only through the program, the Pay for Performance program with our individual clinicians and with the various hospitals, every new contract we do with a health system includes a Pay for Performance program. And that Pay for Performance program is really moving the needle in the right direction, where the focus is on the appropriate care at the appropriate time, and where we can save on extra tests or save on readmissions or save on other things that are costly to all of us and certainly costly to the industry. We're focused on doing that. These are all important, but the main thing that I want you to leave with, and then we'll certainly move to Q&A, is that if we invest, remember I said the growth of obesity in the Commonwealth of Pennsylvania, if we invest as much time and energy in focusing on a wellness initiative, on building products, whether it's us or our competitors, where we partner with employers, where we partner with individual families, not only like a pay for performance for the physician community, for the hospital community, but truly say, let's partner in a way that you focus on healthy lifestyles, whether it's diet, whether it's maintaining your wellness visits, whether it's staying up on your meds. This is where we can really shift the paradigm. And what we're seeing, and I'm certain that our competitors are seeing as well, is that in the hospital community, in the healthcare community, they're beginning to think differently. In the past, it was always about revenue. And what we're saying is, no, it's not revenue. It's not just revenue. It's about outcomes. It's about keeping people healthy and putting them at the appropriate level of care and in the appropriate institutional setting or home health setting. And when we focus on that, everybody wins and overall costs go down. So we will continue to focus on that. And you know that with technology and the use of the internet, I urge you to study the different programs that we have in Independence Blue Cross and certainly that our competitors have, because you'll find there's a lot of opportunities for you to truly impact the cost of healthcare, not only for yourself as an individual and your family members, but certainly as you run businesses to do it more efficiently. You get a workforce that is vibrant, feeling good about them taking control of their health care, not only their health care dollar, but their health in general. It's a neat focus. So in closing my remarks, I'd like to, Stephen Roker stood up a little earlier. Stephen is the Senior Vice President of Operations at Independence Blue Cross. And one thing that we noticed is that we need to be better at focusing on the customer. And we need to, when a customer gets off the phone, to have the customer feel like, okay, I called with a complaint, I had a concern, I couldn't work my way through this complicated system, but you know what? That person on the other end of the phone, they listened to me, they really understand what I was saying, and although it may take a couple calls to figure it out in the most complicated cases, here's an organization that is focused on me and truly cares. And Stephen has led that effort on really understanding the voice of the customer, really understanding that we are there to serve. And what we have seen in our organization is a tremendous improvement in the responses that we're getting from our customers who are calling. And the workforce is feeling good about what they're doing day in and day out because they're taking care of the needs of the people we serve. So I hope you had a chance during the Olympics or on the billboards to see that two things are happening around our organization. One, we've changed our logo. We're now focused on the term independence with the Blue Cross. And the reason we chose to focus on independence because we believe there needs to be an independence in healthcare. There needs to be an opportunity for each and every individual, each and every family to make key decisions about their healthcare. And we are trying to build the tools, we're trying to build the programs, the products that enable families and individuals and companies to do just that. So in that, our second thing is our tagline. And our tagline is changing the game. And it's been on our ads as part of the Olympics. I thought they were pretty good ads too. But what we're trying to say is we need to change the way healthcare is delivered in this country. We need to present products that work for you, and we need to do it in a cost-effective way. Because if we don't, as private industry, the Affordable Care Act is a first step in moving towards total government management and operation of healthcare. Some of you may be for that, and some folks might have credible reasons for that. But we firmly believe at IBC that if we change the cost curve, improve quality, and are there for our customers when they need us, then there won't be a need for more government involvement in healthcare.